Hey everybody, this is Mr. Garberich from About Face Anti-Aging Institute, and today we're doing my most favorite procedure and our most popular, and that's Botox. So I am joined with Amy, and she's going to be our lovely assistant today, and so we're going to be doing Botox in a couple areas. So one is the forehead, so go ahead and raise your eyebrows up so you can see these horizontal lines. These are all coming from the muscle movement in the front of the in the forehead. There's one muscle. It's raising her eyebrows and her eyelids together. So we're gonna take care of that. Go ahead and relax. Now, the opposite is true when she frowns. Frown again, perfect. You can actually see kind of the belly of the muscle here. There's three of them. There's one here, and one here. And the two on the outer sides or edges, their job is to pull the eyebrows down into the middle, and then you can see she's getting these 11 lines. The line across the bridge of her nose is coming from the little muscle in the middle, which is contracting up and down, so perpendicular is this way. So we're going to do the middle here, and then around the eye is a circular muscle. Go ahead and smile. And so you can see she's getting these crow's feet out here. Since this muscle is a circle, the lines can't come off perpendicular, so they come off on different angles or vectors, so that's why we get the crow's feet. So we're gonna get started. I'm gonna go ahead and clean off the area. And Amy has already been screened, and we took a good history, of course, and she has no contraindications. Botox is very safe. It's been around for a long time. We use it all over the body. We actually even use it in the eye for things. So Botox is actually the only FDA-approved product of its kind to be utilized in all three areas: forehead, frown, and crow's feet, or this is also called the glabella. So for that reason, that's why we use it. I also like the effects. They're very subtle, very natural. So what I'm going to do now is I'm going to just mark with a little pencil where I'm going to inject. So I'm more accurate. Some injectors choose not to. I was taught always to do it, and so that's what I do. So I'm going to have her frown in the middle. Again, you can see those muscles contract, and so we're going to do one in the middle. I'm going to hit the middle part of the muscle. Go ahead and frown again. And we're going to hit the tail of the muscle. Go ahead and relax. So when you relax, you can see we're staying inside her pupil. If I were to only inject, say, in the middle, then this muscle would still be active because it's long. And so for that reason, you need 2 injections in this muscle, 1 in this muscle here, and 2 in the other muscle there. Now around her eyes, I'm doing 3 injections. The reason why I'm doing it in this pattern, 1 directly across from her eye, 1 30 degrees down and 30 degrees this way, is because when she smiles, her fan pattern of her wrinkles come directly off her eye like this. Now relax. If she frowned and her muscles or wrinkles rather came down like this from her eye, I would do 1, 2, 3. So now the forehead, what we do is we just go about halfway up, and I start in the middle. Okay, go ahead and raise your eyebrows. And you can see she has wrinkles all the way at top, across. Go ahead and relax. So we're gonna come to the side. You gotta come all the way out to the side. We're gonna do both on both sides here, and then 1 up in the middle. Now this injection pattern is every injection pattern that I've used so far, turn your head this way, is the one recommended from Allergan. Other people will do different injection patterns. You'll see people do 1 here, 1 here, 1 here, 1 here. You don't really need to do all that. If you knock out the muscle, it's gonna work. Now, with that being said, there are always some people who will need a touch-up. So we'll have Amy come back in 2 weeks, and we'll see if she needs a touch-up. So some people's muscles are really active up high, and so in that instance, you might need a little touch-up up there, but generally this will take care of it. All right, so I like to start in the forehead. So Amy, you're just gonna feel a little pinch. By the way, we're using a very tiny insulin syringe, and I don't even go all the way into the skin with it, just the bevel, and it goes into this pinch skin and into the muscle, which gets a little bump. That looks like a mosquito bite. Now that mosquito bite will be there for about 20 minutes and it'll go away. You're doing very well. So I just continue on again. She's tolerating it very well. This Botox will spread about 1 centimeter and will relax the top of the muscle. So the reason why she's getting all of these, turn your head this way, I'm going to do it from this side so you guys can see, is because of that muscle movement that I told you about in the beginning. We do a little bit more right here. And so the reason why we're using Botox is a product that basically interrupts the signal from the brain to the muscle and tells the muscles don't work so hard. And so we're preventing the muscle movement, which prevents the muscle or the lines from getting worse over time. And 2, it actually will treat the ones that she currently has, and it will result in a more smooth appearance across the surface of the skin. Now, Botox lasts about 3 to 4 months. Some people get a little bit longer, some people get a little bit less. It's a bell curve. Most people are in the middle. It kind of depends on her metabolism and also how much that you use. So if we recommend that you get a full dose and you choose to get a half a dose, which is okay. But like Tylenol, if you are recommended to take 2 and you take 1, you're going to get half the effect and half the duration. So up to 4 months, turn this way. Now I'm going to be doing the middle to help with the frown. So 1 injection right in the middle. So this will take care of that little guy that's squeezing in the middle and take care of some of the lines there. Now we're going to go above her eye. Now I'm using my thumb underneath because I don't want the Botox to go anywhere I don't want it to go. So it'll stay right there in the muscle. The first injection is deep. The second one is closer to the surface of the skin because as the muscle travels from the inside out, it goes deep and then it comes closer to the surface of the skin. Now sometimes you see people with funny eyebrows and stuff like that. That's because the injector probably went a little too deep on the outside and they caught the forehead muscle, which is called the frontalis. And so that's why it's important that you go to a very experienced injector to get your Botox done. Now she will see the effects in about 2 to 7 days. Some people, again, a little bit longer. It will peak in about 2 weeks. For that reason, we'll have her come back in 2 weeks and we'll take after pictures. I've already taken before pictures. Very important that they do that. So if you go somewhere and they're not doing that, ask them why. Because it only protects you so you can see after. And so we'll have her come back, and then if she needs a touch-up, then we'll do a touch-up at that time. Okay, so now if you look over here, what we're doing is I'm going to draw up a little more Botox. So Botox comes in a vial. It's freeze-dried, so you have to add a diluting to it. And I use, it's called bacteriostatic normal saline. Some people just use normal saline, and if you do, that's okay. But it's going to cause more pain when you do the injection. Now moving on to the outside of the eye, turn your head towards me. I have them turn towards me. Again, injectors are all different, but when I do it this way, the Botox is going away from the eye, so I'm ensured that it's not traveling again in an area that I don't want it to go. This is a very superficial injection or right underneath the skin, because the muscle is right underneath the skin, so you don't need to go deep at all. So that was that. So you can see that she has these little bumps. The ones on her forehead are almost gone already. So like I said, just give her a little bit more time. What I'll do now is I use a special enzyme gel, which will help soothe the skin, clean off my little marks, and then she will be done. So Amy, what'd you think? How'd you do?
It was really easy.
Not bad? Good.
Not bad at all. There's a tiny little pinch, but not painful in any way. And then you don't even feel it dispersing or anything like that as you would do the injection. So.
Great. So she
She
didn't need, so yeah, we have little squeezy balls. Some people like that. If you need it, it's okay. Some people are a little bit more apprehensive of needles than others, but she did very well. Great job. Again, my name's Mr. G, and that is Botox. So if you're interested and getting your wrinkles taken care of, call the number below, come on in for a free consultation, and I'll get you taken care of. See you soon.